Good morning, everybody. Thank you for the invitation. It's nice to be here, and thanks to the NCD Alliance and Mark Barone for hosting. Uh, as we know, this panel is focused on the current NCD priorities to achieve Sustainable Development Goal 3.4, and I'll be talking specifically about some of the policies and areas of priority that we can focus on. I am trained in public health, and I think, one of the very early lessons that I had, which I'll never forget, it's a very basic lesson, but very applicable to this discussion today, is sitting there listening to the professor when I was very young saying, we have a scenario, there's all these people dying downstream on this river, and everybody's rushing to try to address what's happening? Why are people dying? Let's pull them out of the river. Let's address the issue. And the public health people are the ones that say, wait, what's going on upstream? What's the root cause of this problem? Why are all these people dying? And figuring out what's upstream. Is it a broken bridge? What is it? And addressing that issue. And I think that really has always stuck with me throughout my public health career, because that is what public health is. It's thinking about what are the causes and trying to prevent all this illness and burden of disease and death. And that's what we're talking about here. And I think to Parvi Bhatt's point about COVID, I think that is, COVID has provided us this opportunity. It's been awful, but it's also been an opportunity because suddenly people are recognizing the importance of public health and the need to really think about these issues critically and to plan in advance and to think about what we can do to prevent. So I have a little presentation which I'm going to try to screen share. It's not very detailed. I'll be talking a lot, but again, thank you for having me. I'm speaking in English. I can understand a lot of Portuguese, but unfortunately not a great speaker yet. So thanks for bearing with me. So let me try to share my screen. Let's see. Now, are you able to see the screen? Let's see. I don't think so. Sorry about that. Let me try one more time. Normally it works. Sorry. Okay, well, I'll just keep talking.
Do you want to share the presentation with Mark and
Sure, I will. It's
can you share, Mark, the presentation?
Sure, yeah, send it to my email or WhatsApp, please, and then I share my screen.
Okay, I'm sending it right now. Apologies to everybody. I've never had trouble sharing my screen before. Here we go. All right, so I have sent it to Mark. You should be receiving it very shortly. And again, it's okay if we can't see it, because it's really not a long presentation. But to get started with the obvious, NCDs are a critical issue, and our goal by 2030 is to reduce by 1/3 premature mortality from non-communicable diseases through prevention and treatment, and to promote mental health and well-being. So what do we know? And many of you here, and Mark, let me know if you're having a problem. It should have gone through. So what do we know? We all know very basic information. 41 million people die from NCDs every year, and nearly 2/3 of NCDs are linked to some very key habits and activities: tobacco use, unhealthy diets, harmful use of alcohol, physical activity, air pollution. And so from a addressing the issue perspective, these are really the issues that we want to focus on. It sounds simple, but it's anyone who works in these issues knows it's not as easy as it sounds for many different reasons. Okay, great. So we're on the next slide. Sorry, the following one. Great. So here we are. So the idea, of course, is to focus on developing policies that address tobacco use, address unhealthy diets, harmful use of alcohol, etc. And while we may have clarity on what policies work, and in some cases more than others, of course, tobacco use is something that we've been very clear on for many years now through the help of the Framework Convention on Tobacco Control and the work of so many advocates globally on this issue and other issues. We're still developing the best practices and policies. But we know that as part of the overall effort, we need to raise the awareness on the scale and impact and urgency of NCDs as a health and social justice and equity issue. Highlight that addressing these issues is really a major opportunity, not just to reduce the burden, but to drive economic and sustainable development. And the hardest thing I think is to increase high level commitment across the board by governments and multilateral agencies. But as I mentioned, there are many challenges that come along with trying to address these issues. And you can go to the next slide. Yeah, thank you. As we started to hear in the first presentation, we've had this compounding threat, which is also an opportunity. And COVID-19 has really exposed the weaknesses in our public health systems around the world and the systemic biases in those systems, which again have favored certain populations, where we live, how much we earn, the color of our skin, our gender. These are variables that ultimately drive our health outcomes. And this has really come out so starkly with what has happened with COVID, and in particular in the US, as Dr. Bott mentioned, and in Brazil, we've seen that as well. And the way that governments are choosing to address or ignore the gravity of COVID and its interplay with NCDs is a critical issue within itself. And from our public health context, experts, civil society, academics, we really have to think about framing the issue and informing consumers and decision makers in a way that's clear and understandable to all, speaking truth and evidence to key decision makers, giving voice to those that are not being heard or that do not have access to be heard, and ensuring that the public interest is first in any decision-making table that affects health outcomes. So this is something, as already mentioned, that has really brought the challenges we were already facing with addressing NCDs to even greater light in our contexts. The next slide, please. So, where to prioritize, and I mentioned this earlier. I'm really talking about focusing on those areas that are the cause of 2/3 of NCDs. So, policies to reduce tobacco use, address unhealthy diets and physical inactivity, reduce harmful use of alcohol, and also air pollution issues. Again, tobacco control, the evidence is there. We have many committed governments and advocates around the world that are continually working to implement some of the key policy areas, which include tax increases, smoke-free indoor workplaces and in public places, front of package warning labels, and bans on tobacco advertising, promotion, and sponsorship, especially to the younger population. Healthy food policy promotion is another huge area. It's one that I've personally worked in for over 10 years, very much focused in the Latin America region, Mexico, Brazil, Colombia, and other countries. And we've really focused on, again, taxation of sugary beverages, working towards the implementation of front of package warning labels, bans on advertising, and healthy food policy in the public sector. There's also huge initiatives to reduce salt intake in food and replace trans fat with polyunsaturated fat. These are key areas that have been identified as areas that will reduce overall the burden from that we're experiencing, but there's also a huge element of just raising public awareness through mass media and in other ways. I'm not going to talk in detail about some of the other areas, but I did want to really highlight the last point, which is transparency in government and decision making around policy. With these issue areas, what we've come across again and again and again, and I should have mentioned earlier, I'm coming from a background of working in government for many years, but also in the philanthropic sector with Bloomberg Philanthropies, and then also with NGOs, the Campaign for Tobacco-Free Kids and the Global Health Advocacy Incubator. So I've had the opportunity to sort of see it from many different sides, and transparency in government decision-making around policy and conflict of interest is really, in focusing on implementation of these policies, is really the crux of it and the critical area. We can go to the next slide. So I've touched on a couple of these, COVID as a challenge, but also an opportunity. I mentioned conflicts of interest. This is really, I think, the greatest challenge that we as public health advocates face when we're working to implement public health policy. Obviously, we come up against competing interests. So the healthy food work that we're engaged in, from our perspective, we want to improve health outcomes. The food and beverage industry, their top priority is their bottom line. And so there's an inherent conflict right there in terms of what we're trying to achieve. And I think that that's really where the challenges have risen. Misinformation or lack of information. We're seeing this very much in Brazil and Colombia. Brazil and the US. With COVID, for some reason, you know, our countries are some of the strongest, most powerful countries, but having some of the hugest challenge in addressing COVID. And this has a lot to do with the fact that we're government officials who are elected to guard and protect the lives of their citizens under law are not putting the science first, not putting the public health issues first. They're politicizing the public health issues, and as a result, public health hasn't been the top priority. It's been politics, and we see the effect of that on our population. So that's another huge area that's been a challenge, in particular for our countries. And finally, sort of inaction and inertia. We may know the facts, we may know what we need to do, but there are many competing interests. There are many distractions from the task at hand. So I think while we may know what we need to focus on, how to do that is really where we're facing the biggest challenge. And I see my time is running out, so I will stop there and thank you. And we can talk more in the discussion.